Assalamu alaikum, everyone, and welcome to a new session of MAV Health and Wellness Committee. I'm your host, Asma Shweb. I welcome you on my session, and I would like to remind everyone that, inshallah, this coming Saturday on October 1st, MAV Health and Wellness Committee has arranged for a health fair with free health services on like primary healthcare, skin doctors, dermatologists will be there, along with a psychiatrist. So anyone who needs some sort of advice or some sort of input on one of these specialties, please stop by at Darun Noor from 11 a.m. to 1 p.m. A lot of doctors will be there, and we will be providing these services free of charge. And inshallah, I hope to see everyone there. I hope everyone is keeping safe and has started the new school year with all the fun and somehow the pre-COVID era normalcy. September is a really busy month for a lot of parents and teachers and physicians between immunization and all that, and as well as it's a suicide prevention awareness month. So the goal of my session today is to raise awareness about suicide prevention and the stigmas associated with it in our community in general, with the parents, with the community leaders, with adults in the community, and connect you with the right resources available in the community. Of course, we all know that suicide is one of the leading causes of death in kids from 10 to 14 years of age, and actually is the third leading cause of death from ages 14 to 25. So this is an alarming number, and this is a preventable public health issue. We all have to work together as a community, as individual, as human beings to get knowledge ourselves and then to teach others on how to see the signs and symptoms and what can they do at the right time. There is a new lifeline. Dr. Madaraju definitely will go over that. Like 911, we have 988 now for mental health crisis. Everyone has to have these numbers handy in their house. The kids should have it, the communities, the mosques should have these numbers handy. The schools, of course, they have it. So know this 988, like 911, the lifeline. They also have a website, 988 lifeline.org. If somebody is feeling like not comfortable to chat, and they can not comfortable to talk, so they can always chat on those lifeline. So joining me in my session today to teach us more about suicide in kids and suicide ideation and what we can do to prevent it as a community is Dr. Madaraju. He's the CEO of Century Pediatrics, who have offices in Woodbridge, Stafford, Herndon, and I believe many more. He's very passionate about the topic, and he has like a deep knowledge as a parent and as a teacher, as a doctor about this topic. So I welcome you, Dr. Madaraju. Thank you so much for joining us on this session.
Thank you for having me.
I hope like the session that we do today will benefit others. And please, if you're watching, share this video, save this video, tell your friends to watch it, and save those numbers 988 for mental health crisis. So Dr. Madaraju, you can start with your presentation. I'm really glad you took out some time for us. And
thank you. Thank you, Dr. Asma. Thank you for having me for the Muslim Association of Virginia. So again, I'm Dr. Madiraju. I'm a pediatrician in Northern Virginia. And today we are going to do the second part of the talk. Last time, if you can go back and watch what we did like a few weeks ago, or a few months ago, we first talked about I'm not going to go into the whole details this time because we want to go deeper dive. I just want to summarize what we told last time. We talked about what happens in drug addiction, what's happening in the brain. It's very important to understand that any mental health condition is because of chemical alteration in the brain. It's nothing more than like a fever. So if you have a fever, you go to the doctor and you tell them, doctor, I have a fever, and the doctor will give you medicine. Mental health condition is also something similar to it. So we want to raise that awareness to the public that this is what happens. That in the brain, there are neurotransmitters. We talked about 4 neurotransmitters. One is dopamine, the other one is glutamate. These two are really important in the body's response to any drugs or chemicals. Because we just to recapitulate, like to summarize, dopamine is the neurotransmitter which is important for like our pleasure. Whenever we feel happy, dopamine levels are elevated. Glutamate is something which makes you remember, hey, that was really a happy experience. Let me go back and do the drug one more time. But then it leads to craving, withdrawal, and we talked about the important thing that sometimes the medications or the drugs could be contaminated and it can stop breathing, and how we have to give naloxone to revive the patient. Many people are dying because that naloxone is not available. Then we went and talked about briefly about suicide, like the two chemicals which are involved. Today we'll go a little bit deeper. Before we go deeper, I just wanted to tell you, like, suddenly, let us say your kid comes and says, like, hey, I am not feeling well. I want to hurt myself. It can be a shocking thing for the parents, but you have to take the children's complaint seriously. I would like to share some slides now. Let me see. You guys can see that, right? So
Yes, we can.
the warning signs of depression or suicidal ideation is lack of interest in previously pleasurable activities. Suppose they used to play games before, now they don't want to play anymore. Any of those games. Social withdrawal. Social withdrawal could also be they're giving away their belongings. They don't want to get involved. They don't want to go to school. They're just staying home. The changing in eating and sleeping habits. I want you to remember that not all these things need to be there in a particular child. Persistent sadness, most of the times, unhealthy use of substances that we talked about, and discussions of plans for suicide. When they reach this point that they are having an exact plan, or they are thinking of how they are going to do it, it is really like reaching a stage in which you need to seek help right away. Now, backtrack a little bit, I want to say it right here. When a child comes to the doctor or to the parent, what are we supposed to say to the child? Uh, we are supposed to be very empathetic. We are supposed to be, first of all, straightforward and say, hey, thank you for letting me know that you want to hurt yourself, but you are very important to me. Your life is very, very precious. You are my dear child. I would like to be there. I will do whatever it takes to help you. What we are not supposed to do is say to them that, hey, why are you thinking like this, or minimize their problem, or tell them that, look, you have everything in life. We are in America. Like, why do you need to feel bad, or like make them feel guilty that they are feeling like this? First thing we have to remember is they do not have any control of what is happening in their life. And when these, if you look at the statistics, most of the children or most of young adults, it's like they have come and visited the primary care doctor at least the month that they wanted to commit suicide, which is like really alarming. That means the doctor has missed something which was going on with the children. So asking a straightforward question when you see these symptoms, just keep your mind open. Is the child sleeping too much? Is the child not eating well? Is the child having a social withdrawal? Is having persistent sadness? And then straightforward ask them, and then have a prepared answer. Like, what would you say to the child who is coming and saying this? Tell them that they are important. Tell them help is available. Give them hope. Hope is the most important thing for this child, that help is available, which is in fact, it is available. So just going back down. Yeah. So this is again the last time we went through this. A kid does not have any suicidal ideation, but let us say there is impulsivity and a lot of pessimism. He feels very impulsive and he feels a lot of pessimism that nothing is going to change. And then they say cognitive inflexibility. That means there's nothing which is going to change, and then substance abuse, combination of that, in a kid who has risk factors, either risk factors could be genetic risk factors, or it could be some kind of stressful life event going on in the child's life. In that situation, the child can start planning. But then if something happens, like suppose he lost a job, or like he broke up with his girlfriend, or something which will like really throw them off that thing, this is called a stressor or a trigger, then it can lead them to attempt a suicide or commit a suicide. And also one important thing here is access to lethal means. Access to lethal means could be like, is she or he having a access to guns or like medications, and not being on any treatment, no access to care. So these are like risk factors, and this is called the stress diathesis model. It's very important to understand this model because every one of these are areas which we can really impact. So we talked about this last time. I just want to summarize. A lot of research is happening onto like what is going on in the brain. It's important to understand that there is something called toxic stress. Suppose the child is going through a lot of stress in the house, and we call it like childhood adversity, and there is a genetic propensity in that child, then the HPA axis, the brain hypothalamic pituitary adrenal axis, is affected, and these two neurotransmitters are affected. When norepinephrine is reduced, then it will lead to pessimism. When the 5-HT serotonin is reduced, the kid can become very aggressive and impulsive. So these two can be controlled with medications. Like there is SNRIs and SSRIs, which are like serotonin reuptake inhibitors, which I will talk about. So the next slide shows you like, the brain, normally we have, when we see something stressful, hormone is released, it's called cortisol from our adrenal gland. This is a small gland next to your kidneys. Now, normally this cortisol has a feedback loop and goes to the brain and says, look, enough is enough, let us shut it off. But then if this feedback loop is not closed, and when there is toxic stress, there is uncontrolled production of cortisol. When the uncontrolled production of cortisol is there, it affects our body immune system. That means our body attacks our own body. And then it goes and destroys those two neurotransmitters, serotonin and norepinephrine, in the brain. And that will lead to pessimism and impulsivity. This is very, very important to understand if we are trying to change it. Again, this is a picture of the brain, which shows that a certain portion of the brain is having low serotonin. Now, educational programs like this, are really helpful to detect mood disorders like depression or stuff like that. And then if someone is having a suicidal ideation, we should give them a plan of action. And all the medications that we give work on impulsivity, removing pessimism, and we have to restrict the access to guns and medications and stuff like that so that we can prevent the final act. And as Dr. Asma was saying, that there is a new suicide prevention lifeline, 988. Since it has been put in, there has been increase, at least 50% increase in the number of calls that they are getting. So controlling firearms, restricting access to prescription medication, barriers at potential jumping sites, these are all will reduce the access to lethal means. Now, safety planning, we have to give, like when the child comes and says that, look, I'm feeling bad, then you give them like a written plan. The written plan is, what are your warning signs? When you feel down, what are the things that you feel? You feel like crying, your heart rate is going up, or like you feel there is no hope. Then internal coping strategies, what could the person do? It will be different for each child. They should write down what they should be doing. How will they control this by themselves? And then some people, they want to take a walk, but that's not possible in the middle of the night. So what would they do? at that time. So we need to write it individually for that particular child. And then people who can distract me, write down the name and phone number in that sheet of paper of the person that they can call so that they can explain to them what is going on. And that person should be told that if they receive a call from this patient, then they should take it seriously. And people whom they can ask for help, like they can reach out to the counselor, call 988, or call the psychiatrist and stuff like that. So this has really helped change the way. Again, if the kid already has a plan, if he's a danger to themselves, then it comes to like a different level of seriousness. So these are some of the hotline numbers. I also want to share with you some resources, and I will send this to Dr. Asma. There is a video. It's called We Belong, and this is the link to it. This one shows like what they have done is they have taken some actors and then they have acted and they have shown how depression looks, how bipolar disorder look, all like that they have given it. Also, there is a marijuana talk kit because I told you like mental health illness is very, very common when there is substance abuse. So how do you deal with a child who's having substance abuse? What to say to the child, what not to say to the child. That is a talk kit which is available. And then there is a pediatric symptom checklist, which we talked about, the PSC 17. This is the link to it. I'll be sharing all these links with Dr. Asma. And then for PHQ-9, this is the questionnaire that we use for depression screening. I would like to go to question answer session, Dr. Asma. That way we can elaborate more on any questions that the patients, that the parents may have or your audience may have.
So Dr. Madaraju, give me a few more seconds. I will see if anyone has posted any questions. Otherwise, some people have texted me for the questions. I'll go over those.
Sure, no problem. In the meantime, do you want me to cover a couple more items like which I have in mind?
Yes, please. Please
sure.
Go ahead.
So last weekend, we did a national conference and we had some psychiatrists, and I wanted to share some valuable advice. See, when we do these things, even doctors learn a lot. So I wanted to share some tidbits from what I learned from attending that session. Okay. So number one, this is applicable to like children as well as adults. Loneliness is very, very like a dangerous thing. Loneliness is not good. They are saying loneliness is as dangerous as drinking a lot of alcohol or taking drugs. So it is good if you come together as a community, go to the mosque, meet people, like, exchange ideas, go have like a get together. That's very, very important. Next thing is called broken heart syndrome, which I also came across. Like if a spouse dies, then, it can be a really major effect on the person's life. And that could be a major effect. And they found that a lot of men, they don't do very well after their wife passes away. Same thing for the wife, because they feel so lonely and there is nobody for them to talk to. So which tells us like when we have the time, we should appreciate the spouse, say like good things to them. Like for every one negative thing you should say to your spouse, you should say 5 positive things, and use more I statements than you statements. So that way you don't put blame on your spouse, and just say, I don't think that, I feel that I'm not happy, instead of saying that you make me feel unhappy. And then there is a lot of talk about self-help in terms of saying, just feeling grateful. Gratitude is a very, very useful thing for maintaining the mental wellness. We're talking about illness, but there's a lot of push on mental wellness. Just by seeing, thank God, because of God, I'm doing well. Being grateful for what we have. Gratitude is supposed to be really, really healing from inside. Second thing is generosity, giving something to your mosque, or giving something to somebody like who doesn't have enough food. That is also supposed to be really good for your mental well-being. Another thing is self-compassion. They talked about self-compassion is like most of the times we feel, hey, that guy is not doing well. You feel for another person, but you don't feel for yourself. So taking care of your own self is equally important. It's called self-compassion. So these are the things which are really important. And then again, being optimistic in any situation, you should be optimistic, right? Let us say the storm is coming here. You should say that, look, by today, the storm is going to come, but by tomorrow is going to be a bright day. So look at the bright side of every situation, rather than being optimistic is going to be very, very helpful to tide over any problem. And also prevention wise, it is good to smile more, like as much as possible, smile more and take a walk in nature. So these are mental wellness things which will prevent it. And then I want to give a take home message for all our audience. It's called seeds, seeds, seeds. Seeds meaning first one is sleep. Sleep is very, very important. Okay. Second one is eating. If you overeat or like eat bad food, some foods make you feel really bad, right? So exercise. Last time I said, like, this is very, very important to make you get out of depression and everything. The fourth D is, drugs or drinking. Don't drink too much, don't drink at all if possible. But if you drink, don't drink every day. Okay, try to drink once per week or once per month, but not every single day. So doing drugs is also very bad. The last S is silence. Okay, sometimes you just be silent and just close your eyes, let your mind wander. Some people call it meditation. If you guys are interested in meditation, I have a very good friend who did meditation from Texas last time. I can bring her on your show next time. So remember seeds, SEEDS, seeds. First one is sleep, eating, exercise, drinking or drugs, and then silence. These are the 5 take home mental wellness type of things, which you can prevent bad things from happening. So, questions, I'm ready for questions.
Yes, thank you so much, Dr. Madaraju. This was really valuable, especially the mental health tips. I think each one of us, like these are so easy that each one of us who's watching, and even if we are sharing the video and watching later on, can do that and implement those in our lives. Not as a parent, when you do these steps in your lives, you're not only doing it for yourself, but you're teaching your kids how to take care of themselves. So self-care, meditation, since we are, this is we are going live on a Muslim like a mosque channel. So praying 5 times a day, going to the mosque regularly, helping others is a really, and having gratitude, as Dr. Madaraju mentioned, in our lives helps for your mental health. Really, it does wonders for your mental health. And of course, as Dr. Madaraju mentioned earlier, that this is like fever or any other flu symptoms. Mental health diseases are is a disease, and treat it as a disease. So do whatever needs to be done, spirituality wise, but you need to, you need to seek help, and follow your doctor's advice and guidance. So Dr. Madaraju, I got a question which it says, is depression permanent? If my child is on any medication for depression, would they have to be on it for the rest of their lives?
Wonderful question. Now, we talked about why depression happens. We talked about how to screen for depression last time. I told you PSC 17, and PHQ 9. These are 2 forms that we use. I'm going to show that again. But once you diagnose depression, what do we do, right? So the treatment of choice is 2 things. One is cognitive behavior therapy, CBT, right? That is psychotherapy. But if you just do cognitive behavior therapy, that alone is not sufficient for most young children. Some children just get better only with therapy, but it really is helpful if you can combine cognitive behavior therapy with medication. There is a lot of resistance in our community, especially South Asian community, for medication. One of the primary reasons is they think that once you are on medication, you have to be on medication for the whole life. अरे बच्चा इतना छोटा है और पूरा जिंदगी इसके ऊपर रहेगा, उसको आदत पड़ जाएगी वो मेडिसिन की. This is what people will think. That's not like that. See, it has 80% success rate and it can be tapered down. Teenagers are going through a tumultuous phase of their life. We cannot imagine the amount of stress that the children are going through. Okay. In that particular vulnerable phase, you just save them somehow and bring them until they are like 25, 30 years of age, and then taper it down if as necessary. You can get off these medications also. Sometimes what happens is there is a stressful life event. Suppose somebody went through like a breakup phase with their girlfriend or a boyfriend. That is very, very, dangerous phase for them. You want to give them the medication at the time, and slowly you can bring this down. Again, because the question came, I just want to I wanted to talk about this also. There is the doctors, we think 10 times before we start any medication for a child. Okay. For example, in my situation, I know everything about medication, but I do not start myself the medication. I will send them to a neurologist, like Dr. Latif, or I will send them to a psychiatrist. Because let us say you have a heart problem, right? Would you not go see a cardiologist first, right? So you would go find a cardiologist. The cardiologist is going to do the initial testing. The same way, the psychiatrist is going to check for what other things are coming. Usually mental health conditions, they come with friends. For example, ADHD is there, attention deficit. It is sometimes you may have attention deficit plus depression, right? Sometimes you may have oppositional defiant disorder with ADHD or impulse control disorder. If you treat one and you don't treat the other, then it is not good. Case in point, let us say so the psychiatrist is going to assess what are all the things are there, right? Suppose suppose a person is there, they're depressed and also they have attention deficit. You just treat the attention deficit. Now they can hear very clearly what everyone is saying to them, right? Previously they used to they had attention deficit, they never used to care what other people said. Now they can hear very clearly. So you have to treat. That's why I send them to a psychiatrist. Now some places where there is no specialist, we may not have the luxury, the primary care doctor can start, but it may lead to sometimes half-baked treatment. Okay, so first proper diagnosis. They say measure twice, cut once, right? So you need to get a proper diagnosis. Is it only depression or is it coming with anything else? Then the doctor will say, okay, let me give the smallest dose, which is enough for this patient. Okay, and it is not like a flu medication wherein you would give for 10 days and the patient is going to be fine. Sometimes they need to build up in your body. During that time, people will get oh, ye kaam nahi kar raha, this is not working, let me stop it, right? But we have to keep reassuring them. Look, think at the long term. 9 months from now, your kid is not going to be feeling sad, right? And sometimes the child will, when you start the kid on medication and you see them 9 months later on, and they will be so thankful. They'll be, doc, thank you so much for helping me. Thank you for sending me to the psychiatrist. Now I know that I'm not making these things up. Okay. And they feel like an entirely different person, So these things. So the short answer to your question is it doesn't need to be lifelong. Very effective. Medications are very effective. They can prevent death from happening, right? So it is a valuable tool.
And Dr. Madraju, one more question, and that will be that you can give your personal advice or personal opinion. What is a good age for parents to start talking about mental health and the importance of mental health in their kids? How young a child can be before these words can be introduced into their daily vocabulary?
That's a great question. I think last time I mentioned to you, in my office, I started screening from 5 years of age. When patients come for well check, right? That's the easiest way. Let us say that questionnaire, you have seen the PSC 17 questionnaire, right? I mean, that one just is asking, is your child feeling sad, or is the child hyperactive or something like that? See, mental health condition is like a spectrum, a lot of things can go wrong. It could be attention deficit or oppositional defiant. So this in the community that we are living in, if the kids were back home, it's different. But here, there's so much stress that our kids face. There's nothing wrong in asking your child, beta, how are you feeling? Right? Are you feeling happy? Right? Just today, I had a kid who was just coming with headaches. She came all the way from Woodbridge to Herndon today because she wanted to see me. And while I was talking to her, I just asked her, look, You have been seeing, neurologists, you have been seeing everybody. Are you just feeling sad by any chance? She said, yeah, and that, can depression cause headache? Yes. And then I gave her the PHQ-9, and then boom, it showed that this kid had like depression. So sometimes, unless we ask these questions, the answer will not come. We should not feel sad. In fact, the kid will feel very happy that the parents or the doctor is asking these questions, because they think that the biggest thing with the mental health conditions, they make you feel that only I have this problem. Nobody else is having the problem, right? But the reality is otherwise. 4 million people think about suicide every year in America. If somebody attempts every 4 minutes, somebody attempts to commit suicide. That's how common it is. So when you have such a common condition, which is as common as a cold or a flu, we should like let go of our taboo and save our children. We should ask these questions.
Thank you so much, Dr. Madaraju. Really valuable information, really well-defined, well-explained topic. I hope people who are watching it get benefit from it. If they have any questions, please leave in the comment box on the Facebook post, or you can email me at health-wellness@darulnoor.org. You can also leave these questions on the WhatsApp group, the community WhatsApp group, and message me personally. I can connect you to the available resources, the right resources, and some of the free community resources as well.
One more thing, Dr. Asma,
yes,
before you close out, there is a newer treatment for depression, and I just want your community to know that also. Suppose medication is not working or side effects are there. There is a new treatment. You have heard it on the radio. I think last time I mentioned TMS therapy. It is like, using magnets.
Yes.
There are doctors right here in Northern Virginia who can give that also. So there is a lot of newer treatment modalities available. So as long as they reach out to us, we'll be very, very glad to help them. Yeah.
So the key is, as Dr. Madaraju is mentioning, the key is to know your symptoms and don't hesitate to ask. Don't hesitate to seek help. If it's for you, it's for your kids, it's your family member, friends, do not hesitate to seek help, because there are resources available that can help you. And as we were talking about the medications don't have to be lifelong as well. So please take control of your life, take control of your health, mental health, physical health, emotional health, and stay content, stay happy. I hope everyone stays safe until we meet again on the last Wednesday of October. And as I mentioned earlier, we're having the health fair this coming Saturday from 11 a.m. to 1 p.m. in Darun Noor. Please stop by. We will have doctors of different specialities. They will be able to help you, give you free advice, and guide you and connect you with the right resources. Thank you so much, Dr. Madaraju, once again.
Thank you for having me.
Thank you so much, Brother Rimal, for this or arranging this and helping me with these sessions. Stay safe, everyone, and take care. Goodbye. Assalamu alaikum.